My name is Cynthia Johnson. I'm a student in HSML 4100 Chemical Addiction class. This class is taught by Dr. Sheila Lamar, and I'm taking in the spring 2016 semester in hopes of completing all of the requirements for my LCDC licensure. Okay, so today I want to provide information on chemical addiction, specifically toward the marijuana plant. But when we talk about addiction, I'm referring specifically to a chemical that becomes abusive when you use it or harmful to the person when they use it. So it's more than just recreational or social use, although that's when the addiction usually begins. That's how it starts off as just recreational use. So when we talk about cannabis, marijuana, there are different street names. It can be referred to as Mary Jane, weed, grass, hemp, and those are the old school names that I recall. I'm not sure what any new names are, but that's what I can remember. Okay, the reason why I selected marijuana as a chemical for this assignment is because that's when I been around the most during my high school and my early adulthood years. So I thought it was going to be a little bit easier assignment, so I don't have to cram and study another chemical that I don't know anything about, but at least I do know a little bit about the marijuana plant. Excuse me. So let's take a look at the drug schedule status of the marijuana plant. It is in one of the highest categories in that Schedule 1. And Schedule 1 includes drugs, chemicals, or substances that has no current medical use and has a high potential for abuse. Schedule 1 drugs are the most dangerous drugs on the drug schedule because they have such a high potential of severe psychological and or physical dependency or addiction. However, it's going to be interesting what happens with the legalization of cannabis because of medical use. I wonder if there are going to be enough proposals to get it removed from the Schedule 1 status. I think there are currently 26 states that are legalizing marijuana, and I'm sure that it's going to increase as the economic profits of this particular drug grows. So we want to now talk about how can a person who uses marijuana progress into an addiction? How can recreational use or transition from the first time drug user to drug dependency? There was a study I read conducted by Wagner and Anthony. They concluded that one of the risk factors was the early use. How old was the person when they first had the drug use? Okay, how old were they when they started? We also want to take a look at the neighborhood and the work environment as well. If you really, really look closely, as they did, there was evidence that certain features of the neighborhood, for instance, drug exposure opportunities in particular neighborhoods, that could lead to first-time drug use and sometimes, possibly addiction. Take the drug dealer, for example. Does he live in the neighborhood? Or do they live in the neighborhood? Probably so. You also have to take into consideration the availability of the drug or the weed, if you will. Has there been a big police raid in the neighborhood, or has a major supplier that may be located somewhere else, have they been busted? I remember back in my early days, my youth days, I remember how word would get out on the street on there's no weed in the area, everyone's going crazy, and this is going on. So I can understand where they're coming from as far as availability. Because if it's readily available, that means that, hey, you can smoke whenever you want to or ingest it however you want to partake in it. Smoking, yeah, whatever you do, excuse me. Another thing that helps, I shouldn't say help, but that progresses the addiction is any type of psychiatric or call it behavioral disturbances, mood swings, antisocial personalities. But they also noticed that the male gender is more predisposed toward taking drugs and becoming addicted to drugs. So I'm sure that has a lot to do with the marijuana addiction as well. How does the marijuana impact a person? Okay, this right here is really deep. When you talk about the biological, the physical impact that it does on the brain, that it has on the brain, when you're smoking marijuana, it triggers the release of dopamine, which stimulates the pleasure, okay? And that's the pleasure part of the brain. And then you always want to crave more, okay? It also increases the heart rate. However, it's I want to say just as high as caffeine in coffee or maybe nicotine in tobacco or in a cigarette, okay? So studies have also shown that those who smoke marijuana, they do suffer from similar health issues as smokers, okay? But this is how it works, okay? When marijuana is smoked, the THC passes from the lungs into the bloodstream. Then it carries the chemical to the brain and the other organs in your body. THC acts on specific triggers on your brain cells. These receptors are activated by the chemicals that are similar to THC that is natural in your body. And it's also part of your nervous communication network. That plays an important role in a person's normal brain development and function, and it's also found in parts of the brain, like I said earlier, that influence pleasure, but it also impacts memory, thinking, concentration, time perception, and coordination of your movement. Now, if a woman uses marijuana while she's pregnant, you can, well, yeah, it really does have a impact on the baby. And it usually increases neurobehavioral problems, which develops in the brain of the baby while they are a fetus. Consequences for the child includes problems with attention, memory, problem solving. Okay. Psychological effects. Marijuana overactivates your natural THC system. That's what causes the runner's high that users experience. Okay, these effects includes altered perceptions and mood, difficulty with thinking, problem solving, disruptive learning, memory loss. But they also found that users loses their inhibitions, and some people become aggressive, and some suffer hallucinations depending on the strength of the plant that they're smoking or ingesting. But this is the good news. There are intervention treatments available to those who are addicted to marijuana. Motivational interviewing is a style of counseling used in brief interventions. Okay, brief interventions meaning possibly more than one, two or more, 45-minute conversations or counseling sessions that you have. And they're usually done with users who are in the pre-contemplation or contemplation stage of change. the main goal of the motivational interview and treatment is to get the client to want to change their behavior, okay? So instead of using the normal confrontational approach, there are 5 key concepts that should be included when you're going through the motivational interview. The first one is dealing with empathy. Empathy is where the counselor should empathize, reflect what the client is thinking or what they are discussing back to them. You want to make sure that as a counselor that the client knows that you understand what they are saying. You also want to deal with a client's ambivalence. Sometimes they get torn between if they want to continue using it or do they want to stop. You know, back and forth. I'm sure it has a lot to do with peer pressure or going back into the neighborhood or the environment that, you know, where the abuse is happening. So you have to deal with that, and you have to be very, very careful and non-judgmental as you help the client through this process. You also need to deal with resistance now. This occurs when they are considering going back to smoking. There's a lot of peer pressure. There's a lot of pressure on them, not just peer pressure, but there's also pressure coming from whatever anxiety that they're facing, or the main reason why they have chose to use marijuana as a dependent drug. So you have to deal with that, and you also have to engage them in change talk, sometimes called self-motivational statements. And this is where the client finally starts moving towards changing their mind. They begin to discuss the advantage of changing, the positive goals and the positive things that they can get out of changing out of their addictive use. And last, you always want to increase the client's self-efficacy. That is the key. Their optimistic view is what counts, okay? They have to be able to have a positive view on their own ability to change. You know, that's the key. Once they get it, confident about the change, the positive change that's going to occur, you know, it's almost done. You know, you're at a good point, and the client's at a good point. Last but not least, you have another therapy. It's called cognitive behavior therapy, and that's also successful in treating marijuana addiction. This treatment challenges of any destructive thought processes that the client may have toward themselves, but it also helps enhance self-esteem and deals with any strong emotions that may come forth. You have to be very, very careful if you use this therapy treatment. I would say that this is best used for more experienced counselors. Okay. As I conclude, marijuana is just as addictive as other drugs, based on neighborhood environments, based on the gender, based on any other psychological disorders or mood disorders that you may be genetically dealt with, if you will. But hey, there are treatment out there for everyone who wants help, and that's the thing. As long as you want help, there's help available. So I hope I've shed a little bit of light on marijuana addiction. Okay, let's keep in mind what's going on with the clinical use, the legalization of the clinical use of this plant. And I'm very, very curious and interested on what we as a society are going to do. Are we going to be like, do the same thing that we did with alcohol? It's going to be interesting. So stay tuned. Thank you.